Hello, and this is the wrap up on the new semester recruitment. I hope you all enjoyed your first week of semester and something interesting and meeting with friends. Thank you so much for encouraging and how the words of advancement. All of you and current teachers, folks, and speaking how wonderful it has been seeing you all involved and excited to participate. Whether it be with the learning materials and cameras, and seminars, or workshops. Thank you so much. All of your influences have spoken from it has been and excited to participate further in helping with the learning materials and campus seminars and workshops. A few items to discuss as we wrap up. A few people got a little lost with their timetable in this week. This happens in week one and is okay. From week two onwards, we expect our students to attend their allocated seminars and workshops as per timetable. If you are waiting state for a class, this doesn't mean that you are allocated into that class. Always check what your timetable looks like. Please allow to make sure that you arrive on time to the class. We understand effort was long and there were unexpected events, but this is a good workshops. We have a certain amount of time and we want you to spend as much as this class participating in your skills and preparing for your hours. I have recorded a makeup seminar for week one. It is going to be in module one. Please review this if you are wanting to review the content that was discussed, particularly about placement, attendance, assignment, and uniform. Please make sure to check your attendance grade by quiz on Canvas. You complete your seminar attendance during your class, and your teacher will complete your workshop attendance for you. Monday 8:30 a.m. class will also will do this together for week one next week as we release comments. Please take your time of the waiting list if you are happy with your course. Some people are being moved around and they do not want to because they forgot to remove pressure from the waitlist for some classes. If your name is on the waitlist, the system you do not want to move and will try and move sometimes and you do want to move and will try and move to prefer classes if it can. If you turn up at the seminar or something and you are not allocated to it, it's expected to be turned away. This is especially for workshops. We are limited to how many students we have. If you have many prior assignments, arrangements with me to attend a makeup workshop, this is different as I would if adding school makeup class, so it is not a maximum capacity. Please make sure to attend your workshops very carefully and follow you do not have to be anything independent, but what do you expect from me to understand short pants that are not jeans or leggings, clothes which majority are the arms or except a simple no fake long and hair tie. If you are not wearing clothing suitable to work healthy and safety, you may not be allowed into workplaces for safety and safety. Please remember the people who are in both seminar and workshops. This means that you must attend your allocated seminar and practical workshop. You need to attend a makeup class. You need to provide evidence using the Dropbox email. The company so the makeup email. Please make sure you have created a safe and allocated a spot for exam. This allocated a spot for exam. This is in the same location where you are allocated yourself a seminar and practical workshop. If you need to arrange the use of computer, select it's container email for the alternative arrangements for the day. There are no assessment due next week for NKA, but please keep an eye on these ordinance as always, please post any questions or personal nature, please email to container email, but always remember to state your campus and senior what to do if you miss this is a getting to know you activity to entire distance when it is a gateway. I don't want to do this is a nice use during the practice and before the assessment would not be prior to assessment it was You may feel this does not students who do not submit their assessment during the time to fill who receive for assessment Moreover, also the range of this model will be able to describe safety risk of any programming behavior in the environment and operate professional conduct required to recognize the importance of effective health and safe persons as probably as understand the steps in which safety model and able to apply the effectively in preparation for this week's and health seminar and also please review all the required model content including all lectures and videos. The key content is outlined in the following pages and pages. In introduction to the unit and hygiene keeps reflective cycle. After reviewing the content, please complete the model 1 activity utilizing the reflective cycle. Please be aware that your first assessment for this unit is an only because this quiz makes a part of the unit assessment items and the student can possibly for overall. The quiz will be conducted online and Canvas and the quiz will be covered and the quiz will be covered. Okay. The quiz will be converted into quiz with essays. Means all students will be required to undertake an individual. Uh, All students will be required to take undertake an individual means sequence to exercise foundation. Sequence the means sequence it's a mandatory hurdle requirement and a minimum score of 80% is required in order to pass the edit. We recommend that you practice in the practice and the invigilated means take place students who are not successful will get a second attempt on Monday. We will explain how to allocate into the exam at the time. If you are on the non-compliant with support and applicable to students. So, in preparation of notes of the economic policy statement, many policy detail you can look to access my opportunity only access my and go to learning resources and click to practice at home. Practice at home. Click practice. Do not attempt some databases for website of programs and practice. Ready to focus on. You will be required to purchase the following textbook, either hard copy or ebook with less expensive emails. You will be required to purchase the relevant experience before you can proceed next course. You will know library has a limited number of having this one station for each contest. The foreign readings you can get the reading links to access these readings. You can also find some which read the following. I think before touching the pieces of course after food experience before the aspect after touching the patient after touching the patient's environment after touching the patient's environment hand hygiene technical treatments are not to be used by healthcare workers students and observers of hand hygiene hand wash stand wash hygiene hand wash hygiene disinfection prevention and control patient care stand wash hand wash This is a serious disease that has a significant economic impact on patients and healthcare systems throughout the world. Yet good hygiene, the simple task of cleansing at the right time, is a serious problem and has a significant economic impact on patients and healthcare systems throughout the world. Yet good hygiene, the simple task of cleaning hands at the right time and in the right way can save lives. The World Health Organization has developed evidence-based WHO guidelines on hand hygiene in healthcare to reform healthcare facilities to improve hand hygiene and thus reduce HCI. The hand hygiene technique. Sorry. Healthcare associated infection (HCIA) is a serious disease burden and has a significant economic impact on patients and healthcare systems throughout the world. Yet good hand hygiene, the simple task of cleaning hands at the right time and the right way, can save lives. The World Health Organization (WHO) has developed evidence-based guidelines on hand hygiene in healthcare to support healthcare facilities to improve hand hygiene and thus reduce HCIA. The hand hygiene technical reference manual has been developed to assist healthcare workers to improve it in their facility as part of their multimodal strategy and in accordance with the WHO guidelines. This technical reference manual is designed to use in any healthcare facility. It describes detailed hand hygiene information and is aimed at healthcare workers, trainers, and observers. It focuses on understanding, practicing, and teaching hand hygiene concepts with the aim of helping others to understand its importance and application, particularly important as it provides comprehensive information on an applications of WHO My 5 movements for hand hygiene approach and the practice of hand hygiene observation as well as practical providing practical examples and visuals. Thus, it facilitates increased knowledge on both when and how healthcare workers should perform as well as observed hand hygiene. It can be used to facilitate for formal, informal training and education sessions, helps to support the process of evaluation and feedback in relation to hand hygiene observations. The ultimate goal
Sorry
is
to
to
disturb you, your daddy बोलेर
के अरे
someone is calling you.
साथी तिम्रो लुगा ड्राई गरिदियो तिम्रो लुगा ड्राई गरिदियो
होइन
ए निकाल
अहिले निकाल्न
आऊ मेरो लाइनमा
आइ भन्नु न कहाँ
फरमान गरायो
लाइक
स्टडी ग्राइन्ड भनेर हाल्छ नि
कति कति फर्स्ट म सब्सक्राइब हान्छु साथी
ह
सब्सक्राइब हान्छु
ल अहिले हान्दिउँ ल यसलाई यतै राख
नगएको दिन धेरै आउँदो रहेछ त
यही छ नि कलकत्ता गएर
कबाट
कलकत्ता
भोलि काट्छु कामबाट फर्किँदाखेरि काट्छु अहिले उहाँ गएर टाइम नस्छ
कसले बोलाएको छ साथी
यति हो भित्रबाट सामने आएको
Itu sampai it can be used to facilitate formal and informal training and education sessions and help to support the process of evaluation and feedback in relation to the hand hygiene observations. The ultimate goal is to support the reduction to acquisition of HCAI by improving hand hygiene practices and thus prevent the wasting of resources and save lives. Part 1: Healthcare Associated Infection and Hygiene. HCA Healthcare Association Infection and Hand Hygiene. What is healthcare associated infection and what is its impact on patient safety? Healthcare associated infection, also referred to as nosocomial infection, is defined as an infection occurring in a patient during the process of care in hospital or other healthcare facility that was not present or incubating at the time of admission. This also includes infection acquired in the hospital by appearing after discharge and optional occupational infections among staff of the facility. From the definition, it is clearly understandable that occurrence of this infection is linked to healthcare delivery and that it may result, although not always, as a consequence of failure of healthcare system and processes as well as of human behavior. Therefore, it represents a significant patient safety problem. Healthcare-associated infection occurs worldwide and affects hundreds of millions of patients both in developed and developing countries. In developed countries, it complicates between 5 to 10% of admissions in acute care hospital. In developing countries, the risk is 2 to 20 times higher and proportions of infected patients can exceed 25%, beyond causing physical and moral suffering to patients and their relatives. LCAIs represents a high cost to health system and consume resources that could be spent on preventive measures or other priorities. What is the role of hand in the germ transmission? Microorganism germs responsible for HCAI can be various. What is the role of hand hygiene in germ transmission? Microorganisms germs responsible for HCAI can be virus, fungus. Microorganisms germs responsible for healthcare-associated infection. Infection can be viruses, fungi, parasites, and more frequently bacteria. HCAI can be caused either by microorganisms already present on the patient's skin and mucosa or by microorganisms transmitted from other patients or healthcare workers or from the surrounding environment. In most cases, healthcare workers' hands are the vehicle for transmission of microorganisms from the source to patient, but patients themselves may also be source. Generally, microorganisms are transmitted from one patient to another, from one body site to another, and the environment, and from the environment to patient, or vice versa. Healthcare workers' hands can become progressively colonized by germs and potential pathogens during patient care. In the absence of hand hygiene, the longer the duration of healthcare, the higher the degree of hand contamination and potential risks to patient safety. The risk of transmission and potential harm applies at any time during healthcare delivery, especially immunocompromised or vulnerable patients and are in the presence of indwelling invasive devices and or in the presence of indwelling invasive devices such as urinary catheter, intravenous catheter, endo, endotracheal tube drains. The risk of transmission and potential harm applies at any time during healthcare delivery, especially to immunocompromised or vulnerable patients, and/or in the presence of indwelling invasive devices such as urinary catheter, intravenous catheter. What role does hand hygiene play in the prevention of HCI? Several studies have clearly demonstrated that the implication of well-structured infection control programs is cost-effective way to reduce. Several studies have clearly demonstrated that the implementation of well-structured infection control programs is a cost-effective way to reduce HCI. Some have shown that these results are also achievable in countries and healthcare facilities with limited resources. The foundation of infection control are built on a number of simple, well-established precautions, proving to be effective and widely appreciated. Standard precaution encompasses the basic principle of infection control that are that are mandatory in a healthcare facilities. Their application extends to every patient receiving care, regardless of their diagnosis, risk factors, and presumed infectious status, reducing the risk to patients and staff of acquiring an infection. Hand hygiene is very much at the core of standard precautions and is undisputed single most effective infection control measure. This is also includes circumstances where specific targeted isolation precautions, namely contact hand hygiene is at the core. Yo, क्या रहेगा? Because an state signal was effective in fixed for user. Hand hygiene is very much at the core of standard precautions. Core of standard precaution, and it's the undisputed single. The hand hygiene is the very much at the core of the standard precautions and is the undisputed single most effective infection and control features. This also includes circumstances for specific targeted isolation precautions. This also includes circumstances where specific targeted isolation precautions, namely contact, droplet, and airborne precautions are applied. Furthermore, its importance is emphasized in the most modern bundle or its importance is emphasized in the most bundle or multi modern, multimodal quality improvement approaches for the prevention of specific side effects such as devastating bloodstream and urinary tract infection, surgical site infection, and ventilator-associated pneumonia. The importance of embedding efficient and effective hand hygiene into all elements of care delivery must be kept prominent within healthcare. How to practice hand hygiene? Hand hygiene may be practiced by rubbing hands with an alcohol-based hand rub or washing with soap and water. The technique for doing this, as well as the product used, renders hands free from potentially harmful contamination and make them safe for patient care. Hand rubbing with an alcohol-based formulation. The most effective way to ensure optimal hand hygiene is by using an alcohol-based hand rub. According to WHO guidelines on hand hygiene in healthcare, when an alcohol-based hand rub is available, it should be used as the preferred means for routine and antisepsis. It recommendation as I recommendation IV alcohol-based hand rubs have the following immediate advantages: eliminate a majority of germs, including viruses. The short term required 20 to 30 seconds available of the product at the point of care, good skin tolerability, no need for any particular infrastructures, clean water supply, network washing machines, and hand towel. Soap and alcohol-based hand rub should not be used concomitantly. Recommendation I to comply with routine hand hygiene recommendation, healthcare workers should ideally perform hand hygiene where and when care is provided, which means at the point of care and at the moment indicated. This often calls for use of an alcohol-based product. Hand washing. Hand washing. Hand needs to be washed with soap and water when they are visibly dirty or soiled with blood or other blood fluids. When exposure to potential spore for organism is strongly suspected or proven or after using the laboratory. The process of performing effective hand hygiene, whether rubbing with an alcohol-based hand rub or hand washing, is dependent on a number of factors. The quality of alcohol-based product conformity with European and US standard, the amount of product used, the time spent rubbing or washing, the hand surface rubbed or washed. Hand hygiene alcohol and actions are most effective. Hand hygiene actions are most effective when hand skin is free of parts, nails and nails are natural, short and unvarnished, and hands are forearms are free of jewelry and left uncovered. C-section is therefore important that it is therefore important that a number of steps are taken in process of performing hand hygiene to reduce hand safety for care. Point of care: the place where the three elements come together: the patient, the healthcare worker, and the care or treatment involving contact with patients or his or her surroundings within the patient zone. Point of contact includes three things. Care or treatment involving contact with patients. The concept embraces the need to perform hand hygiene at recommended moments exactly where can delivery takes place. This requires that a hand hygiene product except alcohol-based hand rub is actually applicable if available, be easily accessible and as close as possible within arm's reach of where patient's care or treatment is taking place. Point of care products should be accessible without having to leave the patient zone. Availability of alcohol-based hand rubs at point of care is usually achieved through staff-cared hand rubs, pocket bottles. Availability of hand-based hand rubs are at point of care is usually achieved through staff-carried hand drops, pocket bottles, hand drops fixed to the patient's bed or bedside table, or hand drops affixed to dressing or medicine trolleys that are taken to the point of care. How to hand drop? Hand drop for hand hygiene: wash hands when visibly soiled. Duration of entire procedure. Apply a pin. Apply a palmful of apply a palmful of the product. Apply a palmful of the product in a cupped hand over all surfaces. Rub hand palm to palm. Rub hand palm to palm. Right palm over left torso. Palm to palm with finger intersected. Back of fingers to opposite pins. Use. When to perform hand hygiene, compliance or non-compliance with hand hygiene has consequences for transmission of pathogens and development of HCIs. Hand hygiene is not just an option, a matter of common sense, or merely an opportunity. It responds to indications during care delivery that are justified by the risk of germ transmission. To minimize difference in the way they are understood and applied by healthcare workers, trainers and observers of hand hygiene practices, it is important that hand hygiene indications become universally understandable. There should be no room for doubt or interpretation by healthcare workers, and additionally, if hand hygiene practices are to be evaluated and feedback on hand hygiene to minimize differences in the way they are understood and applied by healthcare workers, trainers, and observers of hand hygiene practice. It is important that hand hygiene indication becomes universally understandable. Hand hygiene technical reference manual: How to hand wash. 5 moments for hand, my 5 moments for hand wash. Become before touching a patient, before clean aesthetic procedures, after body fluid exposures, after touching a patient, after touching patient surrounding. The concept of my 5 moments for hand hygiene. The my 5 moments for hand hygiene concept proposed on unified vision for healthcare workers, trainers, and observers to minimize inter the my 5 moments for hand hygiene concept proposes a unified vision for healthcare workers, trainers, and observers to minimize intra trainers to minimize intra-individual variation and lead to global increase in adherence to effective hand hygiene practice. Considering the evidence, this concept merges. Considering the evidence, this concept merges the hand hygiene indications recommended by WHO guidelines on health hygiene in healthcare in the 5 moments when hand hygiene is required. Importantly, this user and patient-centered approach aims for minimal complexity and a harmonious integration of the natural workflow, which applies across a wide range of care settings and healthcare professions. Duration of hand drop 20 to 30 seconds. Duration of was 40 to 60 seconds. Parvanubharayudaniya. The Why movement for hand hygiene concept proposed a unified vision for healthcare workers, trainers, and observers to minimize intra-individual variation and lead to global increase in adherence to effective hand hygiene practices. Considering the evidence, this concept merges the hand hygiene indicators recommended by WHO guidelines of hand hygiene healthcare. See Part 2 of the guidelines into 5 movements when hand hygiene is required. Importantly, this user and patient-centered approach aims to minimal complexity and harmonious integration into the natural workflow, which applies across a wide range of care setting and healthcare profession. The decision to address hand hygiene by a synthetic concept focusing on only 5 indications is intended to make it easier to understand the moment when there is a risk of germ transmission via hands, to memorize them, and to assimilate them to healthcare activities. To the my ASS IMIS meaning take in and understand fully, regard as similar, to become a part of, assimilate. We are trying to assimilate in our work and to assimilate them into healthcare activities. The My Five Moments of Hand Hygiene was proposed as a reference approach for appropriate performance, teaching, and evaluation of hand hygiene. The concept attempts to go beyond the long list, never exhaustive. The concept attempts to go beyond the long list, never exhaustive, of healthcare actions and situations requiring hand hygiene. It does not define specific and multiple procedures and care situations, but it helps to focus on essential movements embedded with the healthcare sequence that are essential for hand hygiene. The concept does not in any way reduce the need for hand hygiene. It is a tool to identify movements when hand hygiene must be performed and as well as distinguish those when it is not useful. But practicing teaching and observation of hand hygiene. Applying the my five movements for my hand hygiene in practice. The need for hand hygiene is closely connected with activities of healthcare workers within the geographically area. The need for hand hygiene is closely connected within the activities healthcare workers with the activities of healthcare workers within the geographical area surrounding each patient. Focusing on a significant single patient, the healthcare environment can be divided into Focusing on a single patient, the healthcare environment can be divided into two virtual geographical areas: the patient zone and the healthcare zone. The patient zone. The the Wi-Fi movements for hand hygiene are particularly focused on contacting occurring within the patient zone during healthcare delivery in this area. The patient zone includes the patient and some surfaces and items that are temporarily annexed. The patient zone includes patients and some surfaces and items that are temporarily or exclusively dedicated to him or her. It contains the patient zone includes the patient and some surfaces already at exclusively dedicated to him. The patient should include the future subsurfaces and items that are temporarily and exclusively dedicated to him or her. It contains the patient's asks and his or her immediate surroundings. So, this typically includes the patients and all intimate and all inanimate services that are touched by or indirect physical contact with the patient, such as bed rails, bed, bed rails, bedside tables, bed linen, infusing tube, and other medical equipment. It further contains services frequently touched by healthcare workers while caring for the patient, such as monitors, knobs, and buttons and other surfaces. Sorry. Sorry. Critical site of body fluids. The patient zone is not a static geographical area. Example: the area around the patient, including his bed, and furniture, equipment. But the area surrounding the patient and including him/her at any point in time. It accompanies the patient in healthcare area whether he or she stays and goes. The model is not limited to a the patient zone is not a static geographical area, except the area around the patient, including his bed and associated furniture, but the area surrounding the patient and including him or at any point in time. It accompanies the patient in the healthcare area, whether he or she stays and goes. The model is not limited to a bedridden patient but applies equally to patients sitting in a chair or being received by physiotherapists in a common treatment location. As a consequence, the concept of my five movements applies also to situations that define a temporary patient zone. Example, while assisting the patient at a toilet, the patient zone may also vary considering according to setting, the length of the stay, the type of the divided delivered care. Before touching a patient, before clean aesthetic procedures, after body fluid exposure, after touching a patient, after touching patient's surrounding. Patient's surrounding. Patient's surroundings are contaminated by patient's own flora, therefore any items designed for reuse should be previously Patient surroundings are contaminated by patient's own flora, therefore any items designed for reuse should be previously decontaminated when entering and leaving the patient's surrounding. When entering and leaving the patient's surrounding. Therefore, any items designated designed for reuse should be previously decontaminated when entering and leaving patient's surrounding. Any items not usually dedicated to patient care and frequently moved to the healthcare area should never be considered as patient surrounding regardless of their proximity to patient. Example, the computerized or paper chart pencil, except personal belongings are considered part of patient zone since they should not be taken out of it. In addition, items and surfaces temporarily exposed to patients such as surfaces of shared bathrooms, a table of physiotherapy or radiology should be decontaminated after patients has left the healthcare area. The healthcare area corresponds to all surface in the healthcare setting outside patient zones. Shit. The healthcare area corresponds. Adudi, where? The healthcare area corresponds to all surfaces in the healthcare setting outside the patient X. The healthcare area corresponds to all surfaces in healthcare setting. The healthcare area corresponds to all the healthcare area corresponds to all surface in the healthcare setting outside the patient's X. That is other patients. Other? अब खालिदिए एकछिनमा के खाएन के खाएन हजुर के खाएन हौ